Health supplements in this video is what we're going to talk about. And health supplements, we've talked about a little bit in an overall view. Health supplements are accident, cancer, critical illness. They can be dental, vision, short term, long term disability. Those are the main ones that are um, health supplements. It And the thing to remember about health supplements is they pay different. Where your major medical pays the doctor, these are meant to pay you. These are meant to basically maybe not totally replace your income because of a sickness or a specified event, but they're meant to help supplement or take care of you when you do lose your income because of the specified event. For an accident, a cancer, a critical illness, it will pay you. Short term disability and long term disability pays you also. Those are more for business lines, although they can be written for the Medicare side too and are good for the Medicare side in case you have to go into a nursing home or something along that lines. And we'll cover that more when we talk about Medicare in another video. The dental and the vision, that's a little bit different. Um, with dental and vision, some is written with health policies, those pay the um, doctor. You can also get some with other companies, and they can pay you the benefit and reimburse as a reimbursement to you for charges you are out, or they can be paid to the doctor. It is your choice. The benefits are going to be spelled out in the brochures and in the pamphlets. Just remember, most health supplements, and the way to think about a health supplement is instead of paying the doctor or the hospital, it pays you. Okay? It pays you. That's the good thing. That's pretty much all for this video. Hope you enjoy it. And if you have any questions or you want more information or possibly to get a quote on a policy for a health supplement, feel free to give us a call at 662-912-3914. Thank you and have a nice day. Hello, my name is Ken Sigler, and I'm going to be talking to you today about accident policies. An accident policy very simply covers you if you're injured in an accident. So, like falling out your back door, um, if you're in a car wreck, so forth. Most of these policies come with an accidental death benefit rider, to where depending on if you're killed in a common carrier, which is anything you buy a ticket for, such as an airline flight or a bus or um, a cruise, pretty much anything you buy a ticket for. It does not cover the individual like siesta type planes, or basically going out on a pontoon boat for the common carrier. The common carrier usually pays the highest. Next, you have your normal death benefit for an accident, which is if you're out here in your car and somebody runs a light and kills you. That is generally one payment, and then you have your next payment, which is the um, if you're killed doing hazardous activities. And not all policies that are accident offer a hazardous activity death benefit. But hazardous activities, as you can guess, would be like mountain climbing, um, deep sea dive, and so forth. An accident policy generally pays so much for the hospital visit, so much for an ambulance ride, uh, so much for follow-up visits, and it depends on the company and the type of accident and what they do as to what it'll pay. It'll pay for x-rays, it'll pay for certain things. Some of them will pay if your house has to be modified for like a wheelchair, or if you need crutches or wheelchair or braces. There can be a benefit for that. Um, some of them come with a sickness benefit rider built in. Um, this rider, if it's built in, usually runs the price way up on the policy. And in doing so, it will cover any kind of sickness where you go into the hospital. Both accident and the sickness usually cover if basically a wellness exam per year. There can be basically a waiting period for this benefit. Um, Amounts vary as to what they will pay, but there is usually a wellness benefit. Um, an accident policy is pretty much very simple. It's very easy. Um, it is a jet issue policy unless you add on sickness. Sometimes with the sickness, it's a jet issue policy. Some of the exclusions, really, there's not really any exclusions other than basically suicide or attempted suicide, which, as you can imagine, would be excluded from any kind of insurance policy. Um, this is not a life policy. This is written under a health and accident license. So, um, this gives you some information on an accident policy. At Ken's Insurance Agency, we do sell accident policies, and we have some very good ones. If you're interested, please give us a call, and we can set up an appointment to go over our accident policies with you and give you a quote. Our number is 662-912-3914. Thank you, and hope you enjoyed this video. Hi, it's Kenneth again. Now we're going to talk about a cancer policy. There are two main types of cancer policies: the lump sum cancer policy and the cancer policy that's going to pay you a certain amount and a little bit alone. The easiest one to discuss is the lump sum. With this cancer policy, it's going to have basically a certain amount that'll pay for skin cancer. Generally, some do not cover skin cancer on this. And then basically your remaining amount, if you had to use it for skin cancer, would be used for basically if you had internal cancer, and it would pay the rest of the benefit. Once it's paid, it cancels and you cannot get a cancer policy again. The other type of cancer policy that you can get is one that pays basically per item and doesn't cancel. I prefer these cancer policies for the simple fact that if you get cancer once, you're liable to get it again. So the biggest factor here is you want to get this policy just because if you get cancer, it's going to cover you, and then if you have a relapse, it's going to cover you. This one usually has an initial benefit rider, and that basically will give you a certain amount for basically the doctor just saying, you got cancer. As long as he says it and basically puts it in writing, you get paid for it being in the notes that he said you got cancer, even if it turns out you do not have cancer. Um, that rider cancels as soon as you use the uh, payment. The next thing about it is it's going to pay you so much little alone. Now, each cancer policy that's like this is a little different. Some won't pay on experimental treatment, some will. We have both. Um, some will pay, uh, well, they all pay for like chemo, medicine, doctor's visits. If you have to go so far from home, they pay a certain amount for your mileage. They pay for a hotel room for somebody that goes with you to stay in. Um, so, and the mileage is generally 50 miles away from your home. So as long as you're going 50 miles away from your home, then you're covered. Um, when it comes to um, other things that you can have an increasing benefit rider. Also, this policy generally has a wellness benefit. So, women, you go have a mammogram done, you get a certain amount. Men, you get a colonoscopy done or a prostate exam done, you get a benefit amount. Blood work that you have done, if they do a cancer test in it, you get a benefit amount. Um, some of them basically just going to the doctor for a regular checkup, they will give you a benefit amount. Um, and there's many different things in these policies. The easiest way to learn all about them is to sit down and go over a policy. This is just meant to give you a brief overview. Um, some of these policies won't cover skin cancer. Others, you can have it cover skin cancer, but it's going to pay a lesser amount for skin cancer than it would for the internal cancer, just because skin cancer is likely to be cured. Um, I hope this video was helpful in giving you a little understanding of what a cancer policy is and how it can benefit you. Thank you, and I hope you have a good day. Here we are again. Let's talk now about a critical illness policy. A critical illness policy is also known as a specified disease policy. Some of them cover cancer, some of them are lump sum, some of them are going to pay you a little bit alone all the way through and never cancel out. A lump sum policy will always cancel out as soon as you use the full benefit. They will have certain things that they cover at a partial amount. They will have some things that they cover at a full amount. Um, the easiest way to think about a critical illness is it's heart attack, stroke, and then basically some other diseases built in that you may or may not get. But the biggest things that you're going to see with it is heart attack and stroke, because that's what a lot of people suffer from. I prefer the one that's going to pay a little bit alone. It just basically, if you have a heart attack or stroke, chances are, just like cancer, you're going to have it again. You may also have in a critical illness policy a where it covers cancer. Um, sometimes what I'll do is if I've got a cheap critical illness policy that covers a ton of stuff, that's like $6 to about $10 a month for a person, that it goes along with something else I'm writing for. I'll write that, and then I'll try to write a critical illness policy that doesn't cancel. That way they're getting multiple benefits. Um, these policies are age banded. These policies also do have strict underwriting. So they will be looking at an MIB report. They will be looking at your medical records, your medical history, and seeing that you have not had a heart attack, stroke, certain other things that it covers within the past 5 years. If you have, you are excluded for 10 years. Also, if you have the policy and it cancels, you are excluded for 10 years from having the policy again. Um, they are very cautious with these policies. But if you have had a heart attack, stroke, or cancer within the past 5 years, the best thing for the agent to do is just to basically wait on writing the policy and to write it after it's been 5 years. Uh, if it's 5 years and one day, that's great. We can write it. We do offer these policies, and we have some at great benefit to you. Um, we also have different riders on this and on the cancer policy for other specified diseases. So if you would like more information, please give us a call. Our number is 662-912-3914. Thank you and have a nice day.